the patterns of care during the early part of the COVID pandemic really changed. We had fewer patients who were coming to the emergency departments and different patterns of mortality in the community during that time. And there's likely some long-term effects that we'll see as people return to medical care. My name is Laura Walker. I'm the Regional Hospital Practice Chair for Southeast Minnesota and an emergency medicine physician here at Mayo Clinic. The name of our article is The Impact of the SARS Pandemic on Emergency Department Presentations in an Integrated Health System. Overall, we looked at the early few weeks of the COVID pandemic this spring and compared it to the presentations to the emergency departments in our regional healthcare system all across the Midwest to see what changes were had. We looked both at year over year, as well as the 4 weeks leading up to the stay-at-home order in Minnesota, which is really the date where things started to change with our emergency department presentations. We saw that there were about half as many ED patients who were coming to receive care shortly after the onset of the pandemic compared to year over year in the 4 weeks before. In addition to that, we looked at trends in community mortality to see if this may have been a downstream effect to cause an increase in deaths due to people perhaps not seeking care when they should have. And we did see that there were increases in overall mortality. Hospital census was lower during that time. We didn't see much of an impact there in terms of decreased or elevated mortalities. But really, you could see that people are most likely not coming to receive care when they should have, and perhaps waiting too long. A lot of news articles at this time corroborated this. Emergency departments across the country were seeing declines in visits as well. And for us, it was truly across the board, not just our destination practices, but our small community practices also. When we looked at specific diagnoses, we looked at cholecystectomies, appendectomies, MIs, and strokes, and found that we had across the board decreases. We would expect that the number of these presentations would be stable across a population, and they all went down. The difference in our study compared to others that have shown this is it really incorporates a large geographic area and all levels of care. So we at Mayo Clinic have critical access hospitals that are very small and often the only place available in their communities, all the way up to the quaternary care centers in Rochester, Arizona, and Florida. As far as clinical practice, the impacts have been really variable. When we were seeing lower volumes of patients, that we saw our throughput times and things increased, as well as the PPE changes make us a little bit more inefficient overall. And as we've come back to have higher volumes again, we see more inefficiency. And it's a situation where we're going to need to change the way that we do things to provide optimal care. Additionally, we are seeing some patients anecdotally who are coming back with more advanced diseases due to delaying care initially. And I think that's something from a practice standpoint that we'll need to be vigilant about, is any patients who may have had an MI, a stroke, and perhaps didn't seek care at the time are going to come in with more comorbidities and more advanced diseases than they normally would. And that's really going to have a potential downstream impact on patients. And we need to do our best to bring them back into the fold and make sure that they're getting the care that they need. As far as the next steps in this line of research, I think we need to go back and look at this data again to get another updated view and see if these patients who potentially deferred medical care, are they coming to light later and having actual consequences from this? Or is it something where we maybe did keep all of the people who should have gotten care into appropriate care? In summary, we know that patients deferred care during the early part of the pandemic, and we have a lot more work to do to understand the whys behind that, to prevent it from happening again, and also to understand the downstream effects of that on patient health. I hope you find this article informative and helpful, and appreciate you taking the time to read it.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.